Hi, welcome to Medicare Minutia. My name is Tracy and I'm an independent broker. I'm located in the Las Vegas, Nevada area. I've been specializing in Medicare and Medicare products since 2004, licensed since 2001. This video is going to be how to get started with Medicare. If you're close to turning 65, then you're most likely getting bombarded with a ton of mail and probably feeling overwhelmed with all of it. And that's why I'm here to help. Understanding all of this is much easier if we take it in pieces, so don't try to eat the whole pie at once. Grab yourself a pen and paper and take some notes, and if you need to, you can pause the video. Be sure to stay to the end, and that's where I'll give you how to enroll in Medicare. Now, let's get to it. I like to use the analogy of building a house. You need a foundation before you can choose anything else, right? So your foundation is going to be Original Medicare. Parts A and B are also known as fee-for-service. To be eligible for Medicare, you must be a U.S. citizen. Those who are already drawing benefits from Social Security, like the railroad retirement benefits, will automatically be enrolled in Part A and Part B starting the first day of the month you turn 65. If your birthday is on the first day of the month, Part A and B will start the month prior. So for example, if your birthday is June 1st, your Medicare will start May 1st. Those with disabilities under the age of 65 are automatically enrolled in Parts A and B the month after they have received Social Security or railroad retirement disability benefits for 24 months. Individuals with ALS get Part A and B automatically the month their Social Security disability benefits begin. Note that those living in Puerto Rico are not automatically enrolled into Part B, so you must sign up for Part B. Those not drawing Social Security will need to enroll in during the time of what's called the Initial Enrollment Period, or IEP, which starts 3 months prior to the month of your birthday, continues the month of your birthday, and for 3 months following your birth month. Individuals with end-stage renal disease or ESRD can sign up for Medicare anytime. However, the date on which their Medicare coverage begins is usually on the 4th month after dialysis treatments begin, but may be earlier if certain conditions are met. What if you're still working and you want to keep your employer insurance plan? Or should you sign up for Medicare A and B? If you don't need to, why pay for it, right? So if enrolled in a group health plan, the size of your employer determines whether you may be able to delay Part A and B without having to pay a penalty if you enroll later. If you or your spouse's employer has less than 20 employees, it is strongly recommended that you apply for both Part A and B, as the employer coverage might not pay for the health services if you don't have both parts. In this situation, Medicare gets billed first as primary, so the employer plan would be considered secondary, which is why I recommend that you have A and B for those employers under 20 employees. You want to check with the employer of the company's about the company's health insurance to see if it will cover you if you don't enroll in Part A and B. But typically it's safer to take both A and B in that situation. Employers with 20 or more employees, you're typically safe choosing not to enroll in Medicare, as the employer plan would be billed as primary in this situation. Please ask, though, your benefits manager whether or not they provide a group health plan as defined by the terms of the IRS or the Affordable Care Act, and if it's considered creditable coverage. If you want to delay enrolling in Part A and B coverage, you won't need to do anything at that situation when you turn 65. But remember, Part A doesn't have usually a premium payment, so if you're in that situation, then you may want to sign up for Part A. If you want to keep the employer coverage, click the link below to see more about who pays first in the coordination of benefits. So now let's get to the parts, the ABC parts. Part A is your hospital insurance benefits. It also includes your skilled nursing facility benefits, your rehab facility benefits, and hospice. Part B is your outpatient medical insurance benefits and covers physician care, such as also, like your tests, your labs, therapy, medical equipment, and drugs administered by physicians or other healthcare professionals, such as vaccines and intravenous medications. Part C is also more commonly known as Medicare Advantage plans, which are required to cover both Part A and B benefits. I'll cover more of those benefits in a separate video. Part D is your prescription drug benefits, and D for drugs. Those are things you pick up at a pharmacy, not administered in a doctor's office. So things that you're picking up, prescription drugs that you are then taking at home, fall under Part D. And it's regulated by Medicare, but you must purchase a Part D plan through private insurance carriers. I'll put more in a separate video about that. Now that you know the ABCs, you're probably wondering, how much is it going to cost you, right? Those turning 65 and older, Part A is typically premium free. You don't have to pay for it if you've lived and worked in America at least 40 quarters of your life or 10 years of your life. That was being deducted from your paycheck during that time and went toward paying for Part A. So all individuals eligible for Medicare due to disability, though, end-stage renal disease or ALS are eligible for premium-free Part A as well. For those individuals who do not automatically qualify for premium-free Part A, the monthly premium in 2022 can be between $274 per month and $499 per month, depending on how long you've worked in the United States. Part B premium in 2022, the base premium is $170.10 per month that gets paid to Social Security. And this amount can change each year. The premium is based on the past 2 years of your filed income taxes. There's a link in the description so you can see a chart for how much you'll pay if you've earned over those amounts. Now, let me show you where to enroll. SSA.gov. You're going to get this page. It looks just like this. Scroll down and go to Medicare. And then you're going to see how to apply online for just Medicare. So this is if you don't want to collect Social Security, you'll click here. And then you go to apply for Medicare. I understand. Click next. And you'll come to this page. And here's a video here if you need additional help, but you just want to follow along here with their instructions and starting a new application. Okay, so that's the foundation. That's your first bite to figuring it all out. Stay tuned for more videos on what to do next and find out what parts are available to you so that you can finish that house. And those parts are going to be your secondary pieces. So for example, your Medicare supplement, the Part D prescription drug portion, the Medicare Advantage plans, the HMO and the PPO, and I mentioned some of these already. The Medicare Advantage plans are what you see all the time advertised on TV by the celebrities such as Joe Namath, but we can get into more of that in a separate video. For this purpose, I just wanted to keep it short and sweet and give you the information that you need to at least get started. Thank you for your attention. Be sure to subscribe so you don't miss my other videos. Hit the like button. If you're looking for someone to give you an ethical, unbiased, no pressure consultation, please reach out to me via my email and website in the description. I'd be happy to help you get your secondary coverage. I'm licensed in most states. There's no fee. I don't charge a fee to provide that service. So let me know if you need my help. And just to give you a quick disclaimer that we're required to do, I am not employed by, licensed, nor contracted directly with Medicare, and any information mentioned in this video can be found directly on the Medicare.gov website. Thank you for your time. Have a great evening.